A very good evening to you and welcome to Rwanda Television News. My name is Sam Kalisa. Kicking it off, President Paul Kagame has warned local leaders against not quickly resolving issues presented by their communities, telling them not to excessively conduct many meetings because they do not resolve the problems local residents face and instead waste time. The president made the remarks as local leaders concluded their training at Gishari. Sergeant Noire kickstarts tonight's edition with this report.
The local leaders undertook the training following their recent election to office, and the President of the Republic urged them not to disappoint their electorate. You are representing others, and they are the only reason you are in those positions. They put you there. Were you not elected? Then they put you there. Why did they do that? Whenever leaders put their own interests ahead of those of the people they serve, problems always arise. It doesn't matter at which level of leadership. That is what differentiates countries, organizations, and even individuals, with some developing and people living well, or the opposite happening. And the one thing that makes the ultimate difference is that when you do your work selfishly as a leader, things never go well. His Excellency the President also called on the local leaders to work to deal with issues that have continued to plague their districts. Stunting among children, kids with kwashako, some born with such conditions because their mothers may also need assistance, and other problems. We have been dealing with such matters for a while now, and you will find those problems in all districts. Do you ask yourselves what is missing in order to overcome these things? Stunting and malnutrition. Mind you, they have repercussions not just on those children, but the entire country when numbers become high enough. You must understand that when our children are stunted, so is the country. Is that what you want?
So, mushaka kuba igihugu kigwingiye? Do you want to be a stunted country?
Then there is the matter of seemingly endless meetings at the local level that tend to yield little results and instead hinder the work process itself. I therefore want us to understand each other. Sure, there are meetings that solve problems, but let me ask you this. What is the purpose of daily meetings that stop you from receiving and addressing the grievances of the people? What exactly do you hope to achieve doing things like that? What exactly are you constantly talking about among yourselves? People wake up early and come to you to solve their problems, and all you can tell them is that you are in a meeting. Doing what in those meetings? The local leaders took President Paul Kagame's words to heart. This training was very important, and what we learned is that His Excellency the President made a pact with the people so that they may develop and the country may develop as a whole. And the only way to do that is for the social welfare of the people to improve, which is why we are determined to put the interests of our communities before all else, so that our country can continue to be proud of the good leadership practices of His Excellency the President of the Republic. 436 local leaders had spent the last week participating in the training at the Gishari Police Training School in the Eastern Province, with a theme of focusing on the interests of the people they serve, 60% of them newly elected in the recently concluded local elections countrywide.
In yet the latest remarkable conservation story, 30 elegant white rhinos were translocated from South Africa to Rwanda, an activity hailed as the largest single transfer of the species ever undertaken. And as Ethan Tashobia reports, the white rhinos were donated by South Africa's Finda Private Game Reserve as part of a program to keep these special species safe from poaching.
Grazing with paws in the bomas, the endangered 1,000 white rhinos have found a new and safe home in the warm and low-lying plains of Akagera National Park, Rwanda's only protected savanna. Akagera, regarded as Central Africa's largest protected wetland with 2 rainy seasons a year, conservationists believe this is just the perfect environment for these white rhinos, which feed entirely on grasses.
We believe that that this park, this is the first time I've visited here, but just driving from the north, is prime white rhino habitat. I would say probably 85% of white rhino left in the world occurs in South Africa, but they are really they're actually heading to extinction, the white rhino. In the last 10 years, we have lost 10,000 white rhino to poaching in South Africa. That is, it's 3 rhinos a day basically are getting shot and killed. And the reason for that is the demand for rhino horn in the Far East, mainly Vietnam and China. And so in the last 10 years, we've seen an absolute slaughter of white rhino, to the point where I think conservationists are extremely worried.
30 white rhinos, 19 females and 11 males, were donated by Pinda Private Game Reserve, sedated and driven from KwaZulu-Natal province to Durban Airport in South Africa, flown to Kigali aboard a chartered plane, and then transported by road to Akagera National Park, completing a 40-hour journey of more than 3,400 kilometers, a remarkable translocation and logistical mission that cost about $320,000. But the overall cost of this historic translocation could go up to $1 million, according to Jess Gruner, regional manager of African Parks, a conservation organization managing Rwanda's Akagera and Nyungwe national parks.
It's a huge process. Initially thought about 5 years ago, and then really started getting motion 3 years ago. Unfortunately, COVID had a bit of a delaying impact here. It's a figure of about $1 million from building the crates, chartering the aircraft, all the vet expertise, building everything here in Rwanda and transporting them by trucks, and then also looking after them for the next year. Now we have white rhinos. We will always have to look after them, and it'll always need finance or money for that. But we've also built up a team, an extra team of 12 members of staff to track these daily.
The rhinos, which can weigh up to 2 tons, arrived at Kigali International Airport from South Africa in a Boeing 747 in the early hours of Sunday morning, before being transported in their crates to Akagera and later released into the bombers as they continue to get familiar with the new environment. The additional 30 white rhinos bring the total number of rhinos in Akagera to 56, including the black rhinos which arrived in Akagera in 2015 and 2017. Aria Kageruka, the acting chief tourism officer at Rwanda Development Board, says this is a huge boost in reviving Akagera's conservation tourism portfolio.
These things that we're doing today, we're not translocating, or we're not just celebrating that these animals have found, obviously, a secure and safe place, but they will be enabling. It will be just also adding value into our tourism industry, creating more conservation value into this national park, and also for the country. But most importantly, delivering results for communities that we've been partnering for the last many years to make conservation a success story in Rwanda.
According to the Wildlife Fund, the 1,000 white rhinos are now considered endangered, with about 18,000 individuals remaining. The International Union of Conservation of Nature has classified this species as near threatened, but there is belief that in Rwanda they have found a safe breeding space to thrive.
Now, with the introduction of these white rhinos in Akagera National Park, the population of rhinos in total, black or white, gets to 56. Now, the park managers say that the park can accommodate over 300 rhinos, black or white. But that will depend on how the authorities and the managers are able to work together with communities to ensure a safe environment for these endangered species. Reporting for RwandaTV News, Ethan Tashabia in Akagera National Park.
Thank you very much, Ethan Tashabia. To health matters now. Epidemiologists have noted that complying with COVID-19 prevention guidelines is more relevant now than ever as the virus keeps on mutating. Citizens say they have taken solid measures to prevent the spread of the virus. We'd have more. According to the resolutions by the recent cabinet meeting, the Ministry of Health has ordered that people from South African countries will be required to quarantine for 7 days at their own costs. Travelers from other destinations will be required to quarantine for 24 hours and test for COVID-19 after 7 days. The cabinet meeting also urged Rwandans to strengthen measures against the COVID-19 pandemic as the virus keeps on mutating. These residents say they are much committed to fighting the spread of the virus. Epidemiologists find that strengthening measures to fight the virus, including vaccination, is one of the most effective weapons to fight the COVID-19 pandemic. Professor Leon Mutesi is a lecturer and doctor at the University of Rwanda and is also a member of the Rwanda Biomedical Center team for COVID-19 study and mutation. For us to defeat the pandemic, it is necessary to keep up with the measures to continue fighting the virus, like washing hands, wearing face masks, preventing huge crowds, and getting vaccinated, because at this point, the virus can affect both the vaccinated and the non-vaccinated. As I told you, when a person is vaccinated, their body can easily fight the virus. Regarding vaccination, the Minister of Health, Dr. Daniel Ngamije, emphasizes that even if there is mutation of the virus, it is important to get vaccinated because the vaccine is important in preventing the virus. Whatever the case, someone vaccinated has high chances of not getting very ill or even living longer. People should not think that the new variant is resistant to the vaccine. The vaccine was developed depending on the nature of the virus. Maybe the efficiency rate of the vaccine can reduce from 95% to maybe 90%, so it is better than being completely unvaccinated. The cabinet also demanded that people who attend events like conferences, concerts, weddings and other events should be vaccinated and tested for COVID-19, and that event organizers should make sure that those events are conducted from well-ventilated areas. This Monday, the government of Rwanda signed a grant agreement of 44.6 million euros, equivalent to about 50 million Rwandan francs, with the Federal Republic of Germany through the German Financial Corporation, aimed at supporting the social protection sector and small and medium-sized enterprises. Olive Nete with more.
The Minister of Finance and Economic Planning, Dr. Oziel Ndagijimana, has noted that this grant will be invested in projects recoveries that were negatively affected by COVID-19.
And for these grants, worth 44.66 million euro, equivalent to about 50 billion Rwandan francs, related to the support to our response to COVID-19. The two grants include 36 million euro allocated to social protection program through LODA, and 8.66 million euro additional support to small and medium-sized enterprises through a COVID-19 emergency program at Development Bank of Rwanda, BRD. This is a very important contribution as we try to recover from the COVID-19 impact.
The ambassador of Germany to Rwanda, Dr. Thomas Kurz, has noted that Germany will continue to work with Rwanda in facing the impacts of COVID-19 pandemic.
Germany is supporting the Rwandan ambitions in reforming and expanding its social protection services, especially relevant in the light of the current pandemic. As a further reaction to the pandemic, the German government contributed an additional 8.66 million to the Rwandan Export Growth Fund, implemented by the Rwandan Development Bank. Exporting SMEs will continue to benefit from subsidized funding. We're looking forward to continue our cooperation to support the Rwandan government and the Rwandan people in their development path.
To date, Rwanda Development Bank has approved a loan amounting to about 12 million euros, where 11 million was provided by the KfW Development Bank of Germany. According to Rwanda Development Bank, there are other projects in financial institutions worth 16.4 million euros to be funded.
We received the first grant amounting 5 million euros in December 2020. The other grant is this of 8.5 million that we received today. For now, the first was invested in 34 small and medium-sized enterprises through financial institutions in order to reach the beneficiaries. Currently, we have many requests from different banks of 16 million euros to support these projects, but we shall use what we have as we continue to find more.
As of last year, SMEs numbers across PFI's portfolio lending increased by 2.2%, and loan amounts extended to SMEs as percentage of the total commercial loan portfolios increased by 8%. In the same period, average revenue of supported SMEs was 20%, and the average export revenue growth of the supported SMEs amounted to 40%. Olive Nete, RTV News.
Thank you, Olive. Moving ahead, persons with disabilities have said that vocational training is a great way to help them not feel lonely due to their disabilities and strive for development. Ghislaine Mugwaneza has more.
Visually impaired people in Kichicho district are being taught about agriculture relations. Jeanette Biakozimana, who is 29 years old, lost her sight at birth. She says that this profession she's learning will help her change her life. I was born this way. I found myself like this. I couldn't manage working except doing household chores, including cooking and fetching water. When I am going to grow vegetables, I touch everywhere to make sure that there is nothing to distract me. If I start growing these vegetables at home, it will help me to maintain nutrition and sell for markets. A trainer in Masaka Resource Center for the Blind, Medar Munguiko, has said that these trainings and lessons given to these people, including agriculture and rearing of animals, enable them to live a normal life as other people. They
first learn about directions to lead them when cultivating. They know left and right side, in front and behind, and the starting point of the field. We train them on how to hold a hoe cultivating and how to remove grasses in crops.
Emmanuel Ndaisaba, the Executive Secretary of the National Council of Persons with Disabilities in Rwanda, has said that when a person with disability has no occupation, it can easily lead to loneliness and depressions.
When a person with disability has no job, it is a great trouble he or she is facing. He becomes more depressed when a person with disability gets a job and become occupied and start getting money. Those who used to mock him or her no longer see disability but ability in that person.
In this National Week of Persons with Disabilities, the United States Agency for International Development, USAID, has visited what have been achieved so far in the implementation of the project named Umurimo Kuri Bose. This project was launched in December 2020 with an aim to support employment and economic empowerment of 1,560 youth, of which 1,200 are youth with disabilities in 12 districts in Rwanda. USAID officials have noted that it is of a value to improve the lives and rights of persons with disabilities, and they will keep on supporting persons with disabilities.
The benefits, actually, it speaks for itself. So it's employment for all. We are promoting the participation and inclusion of people with disabilities in Rwanda. So meaning that we are not only focusing on youth without disabilities, but we are hugely promoting inclusion of youth with disabilities, different types of disabilities. And we want them to have skills that are employable, that are really key for self-employment or for wage employment.
The Minister of State in charge of ICT and TVETs, Claudette Irede, says that the government and partners will put more effort in boosting the welfare of persons with disabilities.
Like I said, starts from a policy, perspective, where the government itself takes a stand and says we're going to do this. And from the new education sector policy that we're almost concluding, we've made sure that that is included. And also looking at the different programs, be it, the curricula that we've recently made changes in, we made sure that special needs are also included. And so we'll definitely make sure that more centers and more programs in the existing centers are increased.
According to the umbrellas of persons with disabilities in Rwanda, more than 500,000 residents live with different disabilities. Among them, half are women. Ghislaine Mugwaneza, RTV News.
Thank you, Ghislaine. A one-stop border post is going to be constructed at the Rusizi border between Rwanda and the Democratic Republic of Congo. The move is designed to facilitate the movement of goods and people between the two countries, eliminating the practice of double-checking luggage. Serge Node has more.
The border post is favored by truckers, which is primarily why both countries want to upgrade it to a one-stop border post, cutting transit times by half. Talks on the establishment of the border are almost at their end, and the implementation phase will soon follow.
IBM integrated border management system.
It will have an IBM or integrated border management system, so a person coming from Congo will be checked on this side of the border, while those leaving Rwanda will be checked on Congo's side, avoiding double checking. The news has been welcomed by traders using the border, and while the land needed to construct the new border post on the Rwandan side is available, Congolese officials are still working on the relocation process on their side of the border.
La partie du Congo est déjà disponible. Certes, nous avions
The Congolese part is already available, though we are dealing with the relocation process, but we are working so that the construction phase begins as soon as possible.
pouvoir commencer les travaux le plus tôt possible.
The implementation of the project is expected to begin next year and cost between 10 and 15 million US dollars.
The 25 senior South Sudanese officials currently in the country have begun their peace, reconciliation and stability training at the Rwanda Peace Academy in Musanze district. The South Sudanese delegation includes cabinet members as well as senior police and military officials. Serge Node continues.
This latest training comes following another that took place at the academy in July, featuring only senior military officials.
They are here
to answer the question of how they can build up their government, security organs and the military. The current government in South Sudan is just a transitional one, obviously. Their talks here will therefore focus on how they can eventually transition to elections, and they must build up a united military and other institutions. Another important topic is how they can bring back unity and reconciliation in their country. There is a reason why the South Sudanese officials decided to come to Rwanda to do this.
Rwanda, of course, has gone through a conflict similar to our conflict, and it has gone through a genocide process which destructed the fabric of the various communities. This is exactly what Southern Sudan has experienced, and we think that the work done by Rwandans themselves to achieve what you have achieved in terms of peace, in terms of community integration and institutional building is what we need.
Officially opening the training, Rwanda's Minister of Foreign Affairs and International Cooperation reflected on his country's own journey almost 3 decades after the darkest period in its history.
27 years after the genocide against the Tutsi, Rwanda is still going through a process of reconciliation and national unity. This year, our government created a new ministry in charge of national unity and civic education because we are convinced that it is still extremely important to deepen our national unity and strengthen our reconciliation at a time when our population is increasingly exposed to rhetoric that can divide our societies and undermine gains made in our reconciliation process.
The 5-day training was organized by the Rwanda Peace Academy in collaboration with the United Nations Institute for Training and Research and the Joint Monitoring and Evaluation Commission that tracks the implementation of the South Sudan Peace Agreement.
Since 2002, the U.S. Center for Disease Control and Prevention has collaborated with the Rwandan Ministry of Health to respond to public health threats in various areas, including HIV. Over the last 20 years, this support has provided more than $1.6 billion in aid to the people and government of Rwanda. Ahead of the World AIDS Day, celebrated every 1st of December, my colleague Gloria Mutesi sits down with Dr. Thierry Roels, the country director of the U.S. Center for Disease Control here in Rwanda, to discuss the successes and challenges in the fight against HIV in Rwanda.
It's been a great journey, and it's been a great partnership between the U.S. Centers for Disease Control and Prevention and the Rwanda government. We've achieved quite a lot, and be it from the prevention aspect to the treatment aspect and to systems building. I think with treatment coverage close to 98%, with elimination of mother-to-child transmission almost less than 2%, and with voluntary male circumcision close to 90%, I think we've shown that there is big strides that have been made. The work is not finished, but with our partnership, I think we can accomplish the remaining steps as we go forward.
How do you work with the Ministry of Health in Rwanda?
Well, we have funding mechanisms. We call those cooperative agreements, and they're different with the contract. Cooperative agreements that the U.S. CDC has with RBC and the Ministry of Health means we can have substantial involvement in doing the work. And so our teams and the Ministry of Health have weekly meetings where they talk about activities, challenges, modify programs, and how to implement. And that is the beauty of this mechanism, the substantial involvement. You roll up your sleeves together, you sit together in the trenches, and you implement the programs. And you discuss, you share the successes, but you also tackle the challenges as they come along together. And that's what I want to stress, the togetherness. We're equal partners in this endeavor, and that's how we do the work.
What would you say are the areas that are still lacking in the fight of this epidemic in Rwanda?
The areas, again, thank you for the very good question. The areas that are lacking is especially in closing the gaps. There are some areas like the case finding that I mentioned through the index case finding. Young males in certain provinces are still not or don't want to be tested. Also, we have a little bit of issues with the HIV epidemic among children. As you may know, the Rwanda population-based survey, it did not include the children less than 15 years. So we don't have really good data what's happening among the children. We have some modeling and estimates, but that's not like relevant data. So young men, children, key populations, again, it's also targeted. And so there with our expertise that we have, I hope we can close these remaining gaps. Maintaining the gains is another important aspect at the end. Rwanda has come a long way where we are now. And then the third one is sustainability. We need to start thinking about sustainability. We as a team here, United States CDC, is actually helping to work us out of a job. And so at one point we'd like to hand over that Rwanda becomes self-sufficient and implement the programs without the support of the United States Centers for Disease Control team.
Well, despite efforts, there are still many people that lose their lives to HIV/AIDS related illnesses, and millions of people still don't have access to treatment. What's the way forward for this?
In Rwanda, I think we've come a very long way, and there's very few deaths related to HIV/AIDS epidemic. I think what we need to start looking at is that as these people on treatment get older, they also get the diseases that are related to older age, hypertension, diabetes, other chronic illnesses that maybe before we didn't see. So it's important that Rwanda government, and again, maybe with our help, the partnership, we start thinking about what could be done for those cohorts as they get older and older. So I would say to your question, maybe in other countries it is still a problem, but it's definitely not so much a problem in Rwanda.
Certainly good news to hear that. Well, part of the Sustainable Development Goals is to end malaria, TB, and AIDS by 2030. How far, what has been the progress so far, and is it achievable?
I think it's very much achievable. I think Rwanda is on a good track for HIV, for malaria, and for tuberculosis. I think if the gains that I say are maintained and we close the gaps with our partnership, I think we should be able to match it in 2030, which is only, we still have 8 years to go. I would even be optimistic that we can achieve it before 2030.
How does, let me get your opinion about this, perhaps in Rwanda and generally in Africa as well, or globally. How does the political environment or will or policies affect the fight of HIV and AIDS?
Again, I can only speak for Rwanda, but in Rwanda the leadership has been fantastic. And, there's dedicated professionals that implement science-driven programs. They look at their program evaluation. So I would say we're very fortunate here in Rwanda to have good leadership that look at program data and implement it according to what the data say, and it's not wishful thinking.
On behalf of the entire news production team that made it happen, thank you very much for being with us. My name stays Sam Kalisa, wishing you a safe evening and a fruitful week ahead.